boxes otherwise at the moment. So do you want me to mention any of the lists, or is it you?
Hi and welcome everybody to the meeting of the Leicestershire Health and Wellbeing Board. The meeting is being broadcast live via the County Council's website, and it will be archived for people to view afterwards. Following the meeting of the County Council yesterday, the board needs to reappoint its chairman for the next municipal year. I will therefore move straight to that item on the agenda, which is number 1, appointment of chairman. In line with the board's terms of reference, you're asked to note that Mr. Brecken, as the County Council's lead member for health, has been appointed the chairman of the Health and Wellbeing Board. I will therefore hand over to him to take us through the rest of the agenda.
Right, thank you, Matt. Before we move to agenda item 2, I'll quickly confirm the names of those members who have joined us today. From the County Council, I have Mrs. Taylor and Mrs. Radford. I have John Wilson and I have Mike Sands. From the Clinical Commissioning Groups, I have Andy Williams. Sarah Prima is meant to be joining us. I'm not too sure whether she's online at the moment. Dr. Hanlon and Dr. Montgomery. From the District Councils, I have Councillor Kaufman, Councillor King and Bev Smith. From the LPT, I have Rachel Billsborough. From the National Health Service England, I have Hayley Jackson. UHL, I have Mark Whiteman. From the police, I have Chief Superintendent Adam Streets. From the Office of the Police and Crime Commission, I have Simon Down. And from Health Watch, I have Michael Smith and also, I believe, Harsha Katecha. I think we might have a few other people coming on board to help with various reports. So, have I missed anyone from that list? What I would remind members, if we can, is to turn your microphones on when you want to speak and turn it off when you've finished. If you want to speak, please use the hand raise button, and then when you have spoken, remember to turn it off. And I just remind people not to use the chat messenger function if you can, because any chat that you create, whether it's privately or in the group, is available under freedom of information requests. So if there's no, we have a hand raised from Andy Williams. So Andy.
Thank you, Chair. Just to say that Sarah Prima is coordinating the testing work locally that's going on within the city this afternoon. So she's indicated to me she may not be able to join the meeting. So I think we should record her apologies if possible, please.
Okay, thank you. I'll add those apologies to Jane Toman. I have apologies from Jane Moore. I have apologies from John Sinnott. I have apologies from Lord Willie Back, who's obviously got Simon subbing for him. And I also have Dr. Mayor Lacani and Dr. Hanlon is subbing for him as well. So if there's no other apologies, I will move on to appointment to the Vice Chair. You're asked to note that as clinical representative of West Leicestershire Clinical Commissioning Group and Chair of the Integration Executive, Dr. Mayor Lacani has been appointed as Vice Chairman for the Health and Wellbeing Board for the forthcoming year. Item 3 on the agenda is the minutes and the action log. I propose that the minutes of the meeting held on the 23rd of January, which seems a long time ago. A lot's happened since then. It was a short meeting because we had the development sessions after the meeting as part of it. I move that the minutes are taken as read, confirmed and signed. We also have the action log attached, which demonstrates progress with actions agreed by the board. So I'd ask that they are noted. And I'll sign those after the meeting. Thank you. Item 4, urgent items. There are no items that I've agreed as urgent. However, there will be an additional presentation as part of item 9 regarding the local lockdown. Do any members have any interests which they wish to declare in respect to items on this agenda? Under item 5. Councillor King, you have your hand raised. Thank you.
Yeah, good afternoon, everyone. Yeah, I just need to declare that I'm still Vice Chairman of the Board of Trustees of the Carer Centre, Leicestershire and Rowland, in respect of, not that I'm attending on their behalf, but I just am still there.
Okay, thank you. And also Mr. Kaufman.
Well, I put my hand up because to remind you, I'm representing the district councils. I'm a member of Oby and Wigston Council, particularly with regards to lockdown, but I'm representing all the districts today. I'm not there as a county councillor.
All right. Thank you, Mr. Kaufman. Item 6, next we have my position statement. Copies have been emailed to you and a version is also published on the Council's website. My position statement highlights the crucial work undertaken by health, social care and community partners during the ongoing coronavirus pandemic in order to protect residents, local services and in particular our most vulnerable groups. On behalf of the board, I'd thank all those who have helped manage and deliver the initial resilience response and the ongoing recovery work. Amongst several other things, the position statement details the Wellbeing Wednesday social media campaign, where we're sharing and promoting positive mental health and wellbeing messages. The renewed push of the Quit Ready service, which focuses on the financial benefits of quitting smoking, the various health benefits, and also the increased risks of second-hand smoke during lockdown. The Warm Homes project, which encourages residents to get ready for winter now by applying to the project and to contact the existing Warm Home service for advice on staying warm and cutting fuel costs, and a campaign to encourage the reporting of domestic violence. Agenda item 7 on the report is the Safeguarding Adult Board Annual Report 2019-20 and the Strategic Plan for 2020 to 2025, which are pages 9 to 36 in your agenda pack. Our first report presents the draft annual report for the Leicestershire and Rutland Safeguarding Adult Board for 1920 and the strategic plan. We are joined by Francis Pearson, the independent chair of the Leicestershire and Rutland Local Safeguarding Adults Board, who will present the report. So Francis, over to yourself.
Thank you very much, Chair. When I was here a year ago, I was brand new in post, so I was reporting on a year for which I could take no credit for the hard work that has gone on. What I want to present to you today is the total of a lot of effort over the last year. But I'm getting quite a lot of feedback. I'm going to turn my camera off if that's all right for a second to see if it solves it. What I would say though is that your introduction, talking about the pandemic and the local response, underlined for me absolutely one of the points I wanted to make today, which is that adult safeguarding and the very strong partnership that underpins it in Leicestershire is more important now than ever. And I think some of the local responses to the pandemic have illustrated that. So I think it's very appropriate and very timely to be here today. What I wanted to do, and as you've rightly observed, safeguarding adults boards have to do two things. We have to present an annual report of our previous year's work, and I'd invite your comments on this. It's in draft form, which is why I wanted to meet with you today. But we also have to produce a strategic plan for the coming year. And if I may, I'd like to draw your attention to some of the achievements of the last year and think about how those would go forward into the next year. So when I arrived here a year ago, there were 2 safeguarding adults boards across the LLR footprint, doing some work together, but with great scope for much more alignment. And over the last year, that alignment has really happened. And I think it's particularly welcomed by police and NHS colleagues, but by all board members. And I'd like to thank everyone who's contributed to that. John Wilson has been extremely helpful in promoting the importance of that alignment. And I think one of the other things about safeguarding adults boards is they do have a broad membership, and it's very important to engage all those partners and work together to draw them in and see what their contribution is to adult safeguarding. Over the last year, some of our large items around assurance have been on the work of the prisons in the footprint, and really great engagement and involvement from colleagues from the prisons. And we've also sought and done a lot of assurance work on some of our most vulnerable residents who give us great cause for concern. And those are adults with learning disabilities, but very complex and multiple needs. And we've looked very closely at that group of people who form a cohort called the Transforming Care Cohort. And I think that culminated at our board meeting last week, where Andy Williams, amongst others, showed the strength of partnership in helping us kind of get more assurance around the needs of that group. Looking forward, the board has asked partners how we can support and seek the right assurance and ask the right questions as we move to restoration and recovery. And I think that's a conversation that I'd very much welcome having with you. And it may well be that over the coming year, there are things that this partnership would like from the Safeguarding Adults Board, and there may be joint endeavours that we could actually work together much more effectively on. So I'm going to stop there, but I'm very happy to take questions and comments. I'll try switching my camera on again and see if it is all right. Thank you.
Okay, thanks, Fran. Can I ask for any comments from members regarding the draft report that we have here? I'm looking up and down at my little hands. I've got a raised hand from Councillor King. You're still muted, Councillor King.
Yeah, thanks, Lee. It's all trying to do three things at once. Right, let me just find my little crib sheet. Right, hang on a minute. Yeah, okay. So thanks for that introduction to the report. Just one thing I would mention. There's a lot of data presented in the report, which is presented as text. It would be presentationally a lot easier to kind of see that data and understand some of that if it was presented in a visual format. It's just a presentational thing. If it was possible to do that, that would be quite a lot easier for people to see that. But just on the comments I've got, just in terms of the strategic priorities, there seems that there's no specific mention of learning within the priorities, although that is mentioned as a national and local driver, and it is mentioned in the forward of the strategic plan. And the second thing was there doesn't seem to be any reference, as far as I could see, to homeless and rough sleepers, which have been previously flagged as a gap in safeguarding locally. So I'm just wondering what the plan is with that cohort of individuals. Thank you.
Thanks, Phil. Fran.
Thank you very much. Those are really helpful comments. The presentation of the final report will look different, so you will see things presented in the way you've suggested. In terms of learning, I can see actually that's an extremely helpful comment, and we may have done ourselves a slight disservice as a partnership because there is a huge focus on learning. So I think we can take that away and look at it. I would really not like anyone to read our strategic plan and not have a sense that there's a lot of transparency and a lot of desire to change the system through very well established processes. So I can certainly commit to look at that. In terms of homelessness and rough sleeping, again, I think that's a really helpful point, and it doesn't necessarily reflect what goes on in the partnership and the volume of work. So because this is a strategic plan that is going to cover the city as well, I think we can definitely look at the good practice that goes on, what we've learned from it so far, and think about what we might do together and indeed with this partnership over the coming years. So absolutely accepted. Those are really helpful observations.
Okay, thanks, Fran. Councillor Kaufman.
Thank you, Chair. I venture to suggest that Councillor King and I have similar crib sheets. I was going to talk about homelessness. There have not been many benefits. There have been a few benefits out of COVID-19, but one of the benefits is that it's forced people, the government, to get the homeless people off the streets and stop them going into sort of dormitory type accommodation. that has to be a positive, and I would hate to lose the progress that we've made. So if I can support what Councillor King has said, I think that's very, very important going forward. We should actually be learning from what's happening now. Thank you, Chair.
Okay. Thank you, Councillor Kaufman. I have Harsha. You've got your hand raised, and then I have John Wilson. So.
Okay, it's just a comment, really. You've mentioned getting in touch with diverse communities. And I just wanted to raise a point about the fact that safeguarding means different things to different people. And in terms of safeguarding, what an ethnic minority might see as normal behaviour might be seen by others as a safeguarding issue. And we need to address some of that, those issues around what it looks like and what's acceptable and where the line is, at which point it needs to be reported to the authorities, or there's an intervention.
Okay, thank you. Fran, any comments back on that?
Just to say, it almost feels as though the two colleagues who've spoken were at our board on Friday. We agreed very firmly as a board that many board members brought examples of innovation and progress. The one that Mr. Kaufman referred to was one of them, and that we want to support them. And we are going to do some mapping work, seeing what's been achieved and what we don't want to lose in terms of really good innovation and joint working. And Harsha, that we discussed exactly that issue at the board on Friday and talked about some of the work that's going on. And very much your colleague from Healthwatch is going to be involved in some of that, which has started already. So a point well made. Thank you.
Okay.
Okay, thank you. John Wilson. Are you there, John?
I'm on mute again, sorry. So just a couple of things. Firstly, in response to the comments that have been made around homelessness, I do think that we can take that forward as part of the strategic priority around prevention that's in the strategic plan for next year. In terms of the overall direction, I just wanted to say something about the linkage with the city safeguarding board, because we have, as Fran has said, been on a direction of travel now, been talking about bringing together the Leicestershire and Rutland safeguarding board together with the city board for some time, and this is the first time that we've had a joint strategic plan with city colleagues. So previously we've had two boards, we've had completely separate strategic plans, completely separate business plans, and although we've done a bit of work together in terms of things like training and some of the sort of the background stuff, policy development, we've run effectively two governance processes. This is the first time we've sought to bring those together, and the direction of travel is that we will continue to do that over the course of the next 12 months, potentially with the intention of bringing two boards together into a single governance process. I think it would be helpful if colleagues around the Health and Wellbeing Board could think about that strategic direction and provide any comments in respect to that. That we might want to think about in terms of the Adult Safeguarding Board, because we'd very much like to take on board the views and thoughts of as many people as possible across the county before we embark on any specific governance changes. So that's something that I'd be very interested in receiving any comments back on.
Okay, thanks, John. I have Mrs. Radford.
Thank you, Lee. I've only been in post for just over a year, and I found being on the Adult Safeguarding Board very useful in my position as cabinet support. And I've always subbed for Richard Blunt. And quite often we can focus on some of the issues raised at our lead members' meetings. and move forward to see whether it affects us or whether or not we're not, not got it quite right. But I am finding it very useful for what's being brought up at the safeguarding one.
Okay, thank you. That was a good comment. Simon, you have your hand up?
Yeah, thank you, Chair. I just wanted to follow up the comment from John, really. It's been really good to see the progress that's been made, but absolutely, in response to John's question, the PCC's office would very much be in support of the full joining together of those two boards. Thank you, Chair.
Okay, thank you. And Phil, you've got your hand back up again, so if you want to come back on a point or raise another one.
Yeah, thanks, Lee. Yeah, so there were two things. So just picking up on what John just said about Safeguarding Board being a kind of combined board for Leicestershire and Rutland. In principle, I don't have an issue with that. Personally speaking, I can see some advantages to having a more consistent approach to matters, which is certainly useful. I would think, but clearly governance arrangements would be quite important. The one thing I did want to raise was under the development opportunities in the strategic plan, item 3, which is just talks about I'll just mention what it says for those who can't recall. It's development priority 3, strengthening user and carer engagement. And just in the last paragraph, last sentence of that, it says that engagement has taken place on an ad hoc basis, but further development is needed. Well, I would very much endorse that further development is needed, because one of the things that carers do find about safeguarding, it's a very haphazard in some respects. Certainly the carer centre, the evidence is that it can be quite difficult for carers when they are involved in a safeguarding matter, either to report things or, if they're the subject of being reported, to understand what the process is and what may or may not happen as a result. So if anything, I suspect the cases of safeguarding are underreported because people are fearful about what the ramifications will be, perhaps for the person they're looking after or something like that. So I think there is a piece of work there that I think does need to be, and I'm glad to see the board is prioritising that. But if anything, it's something that does need, because there are a lot more people who've been involved in caring situations because of the one of the after effects of the COVID-19 pandemic is a lot more people have got into that role and having to take on that, being a carer for a family member or a friend or whatever. So I think it is really, really important that there is, that is a key priority going forward. Thank you, Lee.
Okay, thanks, Phil. I've just got one more. I've got Mr. Kaufman. You've got your hand back up again. So if you want to raise your point, and then I'll let Fran sum up, and then we can move on.
Thank you, Chair. I just wondered if I could have an explanation. I think I'm struggling with two computers here. There's on page 23, Appendix A. There's the bit in red that talks about all relevant staff are trained for autism awareness, etc. And in brackets, you've got not effective. I just wondered if somebody could explain. It's repeated a few times down there. Does it mean it hasn't happened, or?
Fran.
Thank you. Thanks a lot. What I might do on that point is bring my colleague James Fox in, who is here to give us some kind of technical advice if we need it. James and team have been pulling the report together. James, would you be able to explain that?
Yes, certainly, Fran, certainly, Chair, and Mr. Kaufman. So that's effectively the organisations have self-assessed themselves. We had some learning come from a safeguarding adults review that there needed to be broader awareness around autism and around the specific needs of people with autism in order to providing support for them, but broader awareness across more universal services around autism. And so this was part of a piece of a work to get agencies to have a look at themselves and identify how well they felt they disseminated autism awareness training within their organisations. And these couple of organisations identified that it was something that they needed to do more work on, that it was something that they perhaps hadn't, that there needed to be more work on. I think because we've seen a few agencies identify that, it's something that we would look at as a board to support that awareness and that information so that people can respond to people with those needs, and we would link with organisations that specifically do work and we'll be able to support raising awareness around autism in those agencies. Okay, thanks, James. Mr. Kaufman, I was going to say you put your hand down now, so that's fine. So hopefully that's answered that. Anything else you want to add, Fran? I think you've got a good range of feedback, which is what you were looking for. So anything else you'd like to add?
That's extremely helpful. I'll just respond, if I may, on the point around family carers. It's quite right. Family carers have been under additional strain over the last few months, and are one of the groups of people that the board will probably be taking a deeper look at in terms of their needs when we consider what's been going on behind closed doors is one of the areas I think we're going to take a particular look at. And on user engagement, I would just say that sometimes with the Safeguarding Adults Board, you can complete a task and sign it off and feel you've achieved it. With user engagement, it's something that never stops. However well you can do it, you can always do it in a more nuanced and more effective and more responsive way. So just be assured we will never stop kind of trying to develop our work in that area. So thank you very much, Chair. That concludes everything I want to say.
Okay, thanks, Fran. If there's no more speakers on that, the board is asked to comment on the draft Leicestershire and Rutland Adult Board annual report, which I think we've done so, and those notes will hopefully be useful in taking that forward from draft. So thank you, Fran. Thank you, James. Item 8 on the agenda is the Health Watch Leicestershire annual review, which is pages 37 to 68 in your agenda pack. This report provides a summary of the activity Health Watch has undertaken in its second contracted year. Health Watch's Senior Manager Michael Smith will talk us through the report, and I know obviously Harsh is online as well, so please feel free to add anything you wish to add. So I'll hand over to Michael.
Thank you very much, Chair. Without kind of going through too much detail as far as the report is concerned, what I'm particularly pleased with what we're able to report on, and just to caveat that this isn't a compendium of everything that we've done, it's more of a sample of some of the more impactful work that we've been able to do. So I've been really personally pleased with the increase in activity that we've been able to achieve as far as the activities of not only undertaking the pieces of work and the projects around discharge medicines management, but also offering that help and support for members of the public with kind of helping them understand the situation that they may be presented with and signposting them to other support agencies. But we've been really pleased with the joint working with the work we did with NHS colleagues as well as Health Watch Rutland on doing a very substantial piece of engagement work very early last year around the long-term plan, and that's still an ongoing review and feeding into the recent piece of work that we've been doing around COVID. But I think it's really pleasing that we've been able to kind of develop and grow those relationships as a Health Watch Leicester and Health Watch Leicestershire kind of contract, and trying to make sure that we're respecting that difference between Leicester City and Leicestershire County, and also trying to make sure that we're capturing that different experience of service users and patients, and working with yourselves as our key strategic partners in making sure that that insight is making a difference, and that we're leading to hopefully some real change as far as services are concerned. The just as a kind of a wrap up, as far as the kind of the next steps really, so you're getting a sense of where we're moving and starting to focus on. Already this year we've already done a substantial piece of work with Healthwatch Rutland and the CCGs in Leicester, Leicestershire, Rutland, capturing patients' experience around the COVID lockdown, looking at their access to services, what their experience has been with the changes those services have managed to then put into place to ensure patients were still able to use them. And we're going to be releasing the findings very soon, showing what the experience has been, how the lockdown has impacted on the mental health of service users and members of the public. We're also going to be doing quite a substantive piece of work around how the non-white communities within Leicester and Leicestershire are engaged with, and how that is done well, and how that can be done even more effectively going forward. As far as our substantive work priorities, we're going to be looking at the experience of accessing mental health services when a service user is at a point of crisis. And that's a kind of a developing conversation that we're having with Leicestershire Partnership Trust, as well as the commissioning colleagues, to ensure that we're asking the right questions and we're able to feed the findings back to make the most impact. And we're also going to be looking into domiciliary care and getting a much better picture of what the experience of service users is around domiciliary care, and again speaking to key colleagues in contract oversight within Leicester City and Leicestershire to ensure that we're building in what they know are some of the key areas that we want to focus in. So that's a very kind of a quick whistle stop tour as far as that's concerned, and just really kind of ask Harsha if there's anything else that she'd like to add in relation to the annual report.
I think you've covered most of what I was going to say anyway. Just in relation to the BME Connect project, just to add that we're looking more in terms of how those communities actually connect with health service, so and where they get their communications from, because the go-to generally is let's get it translated, but that's not always the answer, because many people that speak the language don't necessarily read or write it. So translating a piece into that language doesn't help. So that's more of the focus of that. So looking at how we connect and how the communities connect and get their information.
Okay, thank you, Harsha. I have Mrs. Taylor. It was remiss of me when we started the meeting. Mrs. Deborah Taylor, County Councillor, is now in her first day as lead member for children and young people, having taken over from Ivan, who stepped down from Cabinet. So congratulations and good luck with that, Mrs. Taylor. I'm sure you'll do a brilliant job. Your hand is up. Please ask your comment or question.
Thank you, Chair. Yes, and day one of the new job. Just a quick question. Obviously, most of the work of Healthwatch is done by speaking to patients. So I just really want a bit of feedback about how keen people are to give you the information that you're requesting. Is it everyone that you ask says yes, or is it 50%? And then just obviously with COVID, that's obviously affected you quite a lot. And have you looked at other ways of contacting and speaking to patients? So I'm just thinking of obviously next year that your report will be very slim if you've not managed to able to connect with people in a different way. So I'm just wondering how you've managed to do that, please.
Thank you, Mr. Taylor, and it's I'll certainly be in touch if you're the new kind of children and young people's lead to maintain that conversation. I think as far as the kind of engagement side of things, just to kind of to address that, you're absolutely right that there was a kind of an initial fundamental shift of focus to make sure that we're still able to kind of connect with members of the community and ask their experience and opinion around what is their lived reality. The truth of kind of engagement is if you offer an ear to people who have something they want to say, they're often very, very sharing, sometimes to the point where you kind of have to encourage them into a more private space. But it's often about kind of phrasing the question and trying to allow that space for people to kind of share their experiences. And that is something that people tend to be keen on. There is an understanding of the work of Healthwatch, that it will take greater efforts and pains to engage with the more marginalised, seldom heard, whatever nomenclature you choose to use. And so that's one of the reasons why the BME Connect work that we're focusing in on is about making sure that we've got that better relationship with communities that sometimes don't feel that they're as heard as others. I think as far as kind of moving our activities around engagement forward, the thing that we've been very mindful of, and we've followed a lot of other people into the digital domain, and really strengthening our online presence through social media, as well as trying to deliver what we used to do online. So we've already had a series of kind of online coffee sessions, usually with different themes that people can then come and discuss. We've had one around primary care networks. We've got one right now, tomorrow actually, around COOTH, which is a young person's kind of mental health support online. But one of the things that certainly kind of come out in the COVID survey work that we've done is that we have to be so mindful of the digitally excluded, or those who aren't able to kind of utilize the digital platform because of sensory deprivation or for other kind of issues that they live with on a daily basis. So what we're kind of trying to make sure is that there are still methods of engagement through different media outlets. Local radio is a prime example of a good way to get messages out. But as far as our work's concerned, if we can't meet people face to face, then we're already kind of considering how we can make the best use of online workshops, as well as phone-to-phone interviews on a one-to-one basis, and trying to make sure that when we do present the report next year, that it is indeed very rich and full, rather than slim and a bit wanton.
Thank you, Michael. I have 3 hands up at the moment. I apologise if I'm not getting them in the right order, but I'm scrolling down the list here and trying to make sense of it all. So I have Rachel, I have Andy, and then I have Councillor King. So Rachel.
Thank you, Chair. Hello, Michael and Harsha.
Hi.
Michael, hi there. Hi. So you mentioned, I know you can't put everything in your report, and the work that you've done with communities shines through in that. But what doesn't shine through is the work and support that you give to our boards in our organisations. And I wanted to state our thanks and appreciation for that, really, on the record. So we have Mark Farmer sitting on our board. He's an integral part of our board. He brings the voice of communities into our boards, keeps that active and real. He champions that voice and absolutely is integral to our board structure. And I felt it would be remiss not to acknowledge that and to thank you for your support.
Thank you, Rachel. I think you're absolutely right that a lot of the work that we do would not be able to be achieved if we didn't have the support of our volunteer advisory board and also other volunteers that we do. Mark is an absolutely prime example of getting the right person in the right place. You know, his relationships with yourselves, and you have to be commended yourself about your involvement and kind of bringing Mark into the different conversations around ensuring patient representation and patient voice in the conversations within Leicestershire Partnership Trust. It's historically not been as good as it is now, and I think that needs to be commended with that open door approach that I think is really shining through from LP2 recently.
Thank you. Andy.
Thank you, Chair. Well, similarly, I wanted to say thank you to Healthwatch for the report, but also, and in particular, thank you to the partnership working, especially the more recent work we've been doing with your help, or that you've been doing with ours, perhaps is a better way to put it, around understanding the patient impact and the public reaction to the changes we've had to put in place as a consequence of COVID-19. I guess the comment I wanted to make, and we've started to touch on it, Michael, in his last answer, really, but as the subsequent papers for this meeting will show, we've got a considerable amount of work to do to recover the position in health, and I suspect right across actually health and care and wider kind of public policy. I think this board, as a health and wellbeing board, will be very interested in that work, and it's important we do it in partnership. And I think the partnership with Health Watch will be important as well, because partly because of necessity, partly because of opportunity, we will want to change quite a lot of the way in which we deliver care. And there's a lot that's positive about that, but there are some potential downsides too. And I think having a very clear and open dialogue with the public and using Health Watchers as part of that approach is going to be very important to make sure we don't inadvertently create new forms of discrimination or exclusion. And so it's just to kind of acknowledge the importance of that, really. And I think to kind of commend the Health Watch report and this whole subject area to the Health and Wellbeing Partnership agenda going forward. It's going to be a really quite challenging 18-24 months, I think, as we start to try and reset services that have been very considerably disrupted by the COVID epidemic.
Okay, thanks, Andy. I think everyone in this meeting today would agree with that. I think it's going to be a very challenging sort of, probably even longer than 18 to 24 months. And I think in many areas of sort of, what we do as an authority as well. I think that's recognised and that is noted. So, Councillor King.
Yeah, thanks, Lee. Well, actually, I was going to say some of what Andy's just said. Actually, I think my concern, aside from the immediate COVID-19 situation and the response that's still ongoing, clearly with the local outbreak and lockdown, is how health services, particularly, can get back, because obviously there's lots of non-urgent procedures and investigations that have been put off, lots of minor treatments that haven't happened, and whilst they are classified as medically minor, for the patient involved, they're not always considered to be minor, and they can have quite a debilitating impact on individual people and on their families, and that can escalate into quite a more serious problem. And I am concerned that we're not hearing enough yet about what is being done to get that work rebooted in effect and re-going. But I think the Health Watch report in itself is fine. One of the issues I do think that perhaps might be something they might want to look at in the future is basically in respect of rurality. And, representing, most of the districts in Leicestershire are fairly rural areas. Access to health care, access to general practitioners can be patchy in some areas at the best of times. And in some respects, coronavirus has accentuated some of those imbalances. But I think it is nonetheless quite important as the system recovers and rebalances, as Andy was just talking about, that some of those gaps in provision are kind of dealt with. So I'm just wondering what Health Watch is, whether you're going to have a look at that. And the second thing is, I just wonder what Health Watch is doing to connect up better with the district health and wellbeing boards, because we do have those at district councils, although they're not a statutory in the same sense as this. So I'm just wondering what's been done to kind of, get more of a temperature check of what's going on there, and to get feedback from them as well, from a very much more local perspective than perhaps what you do at the moment. Thank you.
Thank you, Councillor King. I think you're absolutely right on many counts. I think the issue around kind of rurality and the impact that it has in relation to access to care, I think is something that I'd be very kind of keen to take away. We have, because of the contractual arrangements for our contract, there are special projects that we can put forward, and they're agreed to do much more bespoke kind of pieces of work and engagement. And I think the kind of impact on rurality and access to services, I think, lends itself very well to that. So I'd certainly be kind of putting that forward as a potential special project for us in the coming year. I'm very kind of interested in the comments you're making around the district councils and their health and wellbeing boards. It is something that we are very keen to kind of re-establish the connections with, because of that much more specific understanding of the community of that district borough. And I know that some of my team have been able to build relationships with some of the district borough councils, but we've not been able to do it for every one of them, and that certainly will be a focus for us this year. We've been able to kind of get ourselves back up to a full staffing complement, which has been a frustration. And with that full complement, we can ensure that all the district boroughs, certainly in Leicestershire, are covered, and that will be a key target for us to be able to show that we're having the right relationships in the right place.
Okay, thanks, Michael. I think that's been pretty well discussed. I think you've had some good feedback. Certainly, I'm looking forward to the mental health care at point of crisis. I think certainly COVID-19 has created an issue where school-age pupils, primary-age pupils, right across the board, right the way to elderly people, have suffered from their mental health, and I think that will be a very interesting something that I'm certainly looking forward to seeing. So can I thank you for your report? Can I thank both Harsha and Michael for the presentation of the report? And we're asked to note that report, so thank you.
Thank you very much, Chair.
Item 9 is the coronavirus COVID-19 impact and response to the local care system, pages 69 to 71, and also a supplementary report that you have been emailed. It provides members with an update on the impact and response to the COVID pandemic by our local care system. A supplementary report has been circulated to members separately and is published online now. In addition, as mentioned earlier, the Director of Public Health, Mike Sands, will talk us through a brief presentation concerning some of the data associated with the local lockdown. I'll hand over to Mike first, and I also believe that Andy Williams and also John Wilson, will present elements of the report as well. So, Mike, over to you.
Yeah, thank you, Chair. Very much as per your introduction. So I guess when we first talked about having a health and wellbeing board today, and about doing a report on coronavirus, that we were hoping that the pandemic will have calmed down. But as Councillor King was pointing out, at least locally, that's not very much not the case. So it is probably opportune that we review the impact and the response, particularly of health and social care, to COVID-19. I then would want to introduce the outbreak control plan that we published on the 22nd of June, and then just give a brief update on the local lockdown and some of the data that we've now got, just to explain where we're up to. So if I ask, I think it's Andy to go first on covering the health aspects of the paper, and then John.
Thanks, Mike. So there's quite a lot of information in the paper, Chair, and I won't go through all of it in detail. What I would like to do, of course, I'm happy to answer questions, but what I would like to do is just give a bit of an overview, I think, from an NHS perspective. The crucial thing, I think, to stress, well, there's a few things to say, really. First of all, I would very much like to thank partners. I think the response within the NHS has been a partnership-based response, and there's been phenomenal team working, actually, right across the statutory sector and with the voluntary sector, and indeed the private sector, actually, as we've put together the health response to this challenge. The headlines from that, I think, are that we were very effective in initially creating the additional capacity that we believed would be necessary to manage the impact of coronavirus. There was a massive concern at the beginning of this outbreak that the healthcare and health and care system would simply be overwhelmed with a very large number of people acutely unwell. And we took considerable and very rapid action to put in place contingent capacity. Throughout the crisis to date, we have coped within that contingent capacity. We stood up extra capacity in secondary care. We worked very closely to create capacity in the private sector. Primary care has continued to deliver services throughout. And so it's been very pleasing in a way that we've been able to manage those pressures within the local system. There was, however, a very considerable price to pay for that, because in order to generate that capacity, we had to facilitate the rapid discharge of people from hospital. We've had to cancel a range of elective procedures, and or delay or create delays for patients and for the public in respect of some of those services. We have had some operational difficulties in supply of PPE in the supply chain for protective equipment, as well as some difficulties with the supply of things like reagent for the testing program. And they are described in the paper, but I don't wish to dwell on them because I think generally the message I wish to get across to members of this board is that the partnership-based response and the NHS-based response locally was very positive. The second thing I think I'd like to do in summarising this element of the presentation is to pay tribute to the staff involved. I think the response of staff within the NHS, across local government, and across the wider health and care partnership has been extraordinary, really. People have worked incredibly flexibly with a lot of goodwill, often under very considerable strain and pressure, and have done just the most incredible job. And a big thank you to the wider community, to local political leaders as well, for acknowledging and offering regular incentives and recognition of that work. I think that's been very, very helpful. Coming out of the situation, there's a couple of things to say. First of all, as the current situation is reflecting, we are going to have to face the reality of living with COVID-19 and coronavirus in the context of healthcare for some time. It hasn't gone away, and it won't in the immediate future. And so we have to be cautious in restart. And we are restarting from a very difficult place where we've got backlogs of work, we've got considerable pressure, we still have to maintain contingent capacity. And of course, we're now working with a workforce that is tired, that has worked incredibly intensively. And there is no obvious and immediate prospect of that easing off. So the restart process will be very complicated. We have got detailed restart plans, which we've been sharing and working through. We are beginning now to release capacity to deal with some of the backlog in elective work, and we are using the independent sector as part of that, as well as our own capacity. But it will take a very long time, I think, to actively get into this work. The final thing, just to say from my point of view in summarising the health response, is that there, ironically, has been some fantastic progress in aspects of modernisation of care delivery and partnership working, which we're very keen to build on going forward. And the plan sets out 10 principles generated from a clinical consensus exercise that local clinicians felt were important to try and capture going forward, positives, if you like. They've been informed and will continue to be informed by the patient and public view, and particularly I should acknowledge here the input of Health Watch again in helping us to shape that. But I want to stress that these are principles. We're not suggesting for a second that these 10 principles are set in stone. We're using them as the basis for more detailed work now across health and care. And it's something that we will want to share with this group, but also with scrutiny and with the public generally, because as we start to develop and refine those plans, we will need a very structured and comprehensive process of public engagement going forward. So a lot to cover. That's a very, very brief synopsis of it. But I hope it just draws out the report itself, and those comments just draw out some of the key issues from a health perspective.
Okay, thanks, Andy. Councillor Kaufman, I know you got your hand up, but what we'll do is we'll have all three speakers on this, and then I'll open it up for questions and comments. Okay, thank you.
Hi, so I'll just give a very brief overview then from a sort of more from a social care perspective, and I'd echo many of the comments that Andy's made in terms of the fact that one of the I suppose significant issues that we have dealt with over the course of the last few weeks is the need to work together rapidly in areas that are completely uncharted for many of us. And I think it's absolute testament to everybody who has been involved throughout all organisations, that we have managed to do that in a way that has, to a large degree, been successful for the majority of the population and for the services that we support and for the people who are supported by them. Now, obviously, that's not to deny or to reduce the significance of people who have been impacted, because clearly there has been a very big impact on a number of people and on a number of families. From a social care perspective, the largest area of impact has clearly been in our provider market, which is to say our care homes and our domiciliary care providers and our daycare providers. Overall, we've seen around about a third of our care home providers see outbreaks of COVID affecting their residents, and that's been a tremendous shock to those providers and to the people who work in those services and to the families of people who are living in residential care services. The position currently is much improving, so I think it's worth noting that we now only have around about 4% of our providers who are experiencing an outbreak. So the numbers are coming down week by week. The numbers of people who are affected, it's coming down week by week. Overall, the numbers of residents now who are, for our latest information in terms of testing, Mike might have even more latest information given what's happening locally, but certainly the last information I saw was that we're only seeing a small percentage of residents now who are being tested, who are tested positive, and an even smaller number of staff. So we are moving in the right direction in respect to managing to get on top of the infection control measures that we need to put in place and ensuring that we are protecting people as far as is possible. There were a number of issues in the early days. Back in March, as you will all be aware, issues around PPE, accessibility of PPE and shortages in that area. We got on top of that very quickly in Leicestershire. And together with our partners in the LRF, we've managed to have a very good position in terms of that. So we've not had major shortages since those early weeks. One of the areas that we were obviously very concerned about was the ability of domiciliary care to be able to continue to maintain a service throughout the pandemic when they could be stretched in terms of having to reduce staff capacity and increase demand. Again, that's not been the case. We've managed to, as Andy mentioned in terms of healthcare, we've managed to maintain services, and the capacity for services to continue to deliver has been good throughout, supported by a very good recruitment campaign that we ran locally on behalf of all providers. One thing that has been very different, something that 15 weeks ago we weren't doing at all, and over the course of the last 15 weeks we've had to run at pace with, has been the shielding vulnerable people work. And we've done that together with colleagues in the districts particularly, and together we've managed to support the 15,000 people who are registered as requiring shielding across the county, and we continue to do that. That's been a big learning curve, and we've had to put in place a whole host of systems and processes that we simply didn't have before, and we've managed to do that successfully. There's an area that we probably just need to be aware in terms of finance from a social care perspective. We're expecting that the additional costs of COVID for the County Council this year run for about £15 million. So it's a significant level of expenditure, and that's just the social care. Healthcare will have their own numbers, and the district councils will have their own numbers. County Council's overall number is many times much bigger than the 15 million, but it's a significant amount of additional investment that's had to be put in place in a very short space of time. In terms of our recovery, again, we have some principles that we're working to. We're going through a whole process of recovery, as you can imagine. It says in the report 115 changes. I think there's now 130 something changes that we've just within the social care department that we've identified that we need to put in place post-COVID. I think the first thing I'd say is that we are not in full recovery yet. So as a social care service, as an adults and communities department, we are still very much dealing with COVID. We are not yet in a recovery phase. We are moving towards that process, and we are putting our thoughts to what that will look like. And we've given you some ideas of what the opportunities and challenges might be around that. But certainly we are still very much in the midst of the COVID work at the moment. Going back to where we started, one of the biggest issues around that will be provider sustainability. So we are working with the provider sector to look at what the impact of COVID has been on them, particularly the residential care sector, where we know now that on average we have a 80% occupancy across the county. That's reduced from 90%. So pre-COVID we were at 90%, we're now at 80%. What that means is that for some providers that will be considerably lower. That's an average number. So there are providers who will be substantially at risk coming out of this period. And similarly with the other big impact has been on services around things like community and day services, where their entire model is based on socialisation, bringing people together, having social contact. Clearly all of that has had to be rethought, reconsidered, and many of those providers again are struggling to continue to provide services for people who require them in a way that allows for social distancing and infection control. So very different models of care are going to have to develop as we go forward across the county with those providers. So I'll leave it there, I think.
Okay, thank you, John. And then lastly from me is just a bit to the end of the report on the local outbreak control plan. So as it says in the report, towards the end of May, the government announced that as part of its strategy to reduce infection, every upper tier local authority had to produce an outbreak plan. And Leicestershire, along with Leicester City and Rutland, are one of 11 beacon areas throughout the country to develop these. We published our plan, as everybody else had to, by the end of June. And we provided a link to the County Council's website where you can see it. I don't think we actually attached the plan to the report. Without going into detail, it is a plan that sets out a number of things, how we would go about sourcing and deploying additional testing capacity if we needed to do so. It also sets out how we would support vulnerable people, those who need to self-isolate, who don't have necessarily any other source of support. It also set out how we would use data to identify hotspots. And then lastly, and probably most importantly, it set out a routine for how we would manage outbreaks in educational settings and care settings and other high-risk settings, such as, for instance, homeless hostels and domestic abuse refuges. It is a plan that might be produced by the County Council, but it's very much one which we produced alongside partners in health and with district councils, recognising the environmental health expertise and their knowledge of the complex outbreak settings, again, homeless shelters being one of those. And it also sets out the routine by which we would manage outbreaks. As always, a plan is only lasts until its first contact with the enemy. And of course, not long after, in fact, 2 days before we published it, along came the Leicester local lockdown, with, on the evening of Monday, 29th of June, the Secretary of State for Health and Social Care announcing the introduction of a local lockdown for Leicester City, and as board members will be well aware, parts of the surrounding county. Obviously, we've been working very hard and very closely with city colleagues and Public Health England and indeed health colleagues to firstly define the lockdown area, but then get a grip on the virus, both within Leicester City and surrounding areas. Immense amount of national support going into the lockdown area in terms of additional testing capacity, support, logistics support and project management support from the military, from Public Health England and from DHSC. And again, I think the issues with that and the progress that has been made has been well documented in the media. And certainly there are initial signs that things have stabilised and then maybe dropped a little bit in the city, which is a good start in the short time that lockdown has been in operation. So this obviously is an important issue in itself. I think from my point of view, it also gives us a chance to look at the outbreak plan as published and then to review it continually as we go along to make certain it's fit for use in the heat of battle, so to speak. So I will cover local data on infections in a moment, but I wonder, Chair, if it's best to sort of pause there and do questions on the content and business of the paper first.
Yeah, thank you, Mike. I think that's what I was just talking with Matt here, and I think we're both of that view. So I think if we take questions on what you've had sent in the report and what's been presented by sort of Andy, John and Mike, and then Mike has obviously a presentation which is updated, and that really goes into lockdown data, so we'll deal with that after. So I have 3 hands up at the moment. I have Councillors Kaufman and Councillor King and also Mrs Taylor. So Mr King, I think you were, if I take you first. No? Okay, I've still got your hand up there, Phil, so that's okay. So I'll take Councillor Kaufman.
Thank you, Chair. First of all, apologies for the background noise. There are builders here. I hope you can hear me. It's just started this second.
So you got Bumblebee going. So.
Okay, I'll try. I've got to express my disappointment as to what has been happening in Oby and Wigston and what appears to be a complete confusion in the way this lock-up and getting out lockdown has been administered. We've had 3 meetings of members of Oby and Wigston Borough Council this week, and on the last meeting it was made pretty clear to us that there was going to be a policy of encouraging the whole population of the borough to be tested, not just those with symptoms, but it was going to be if you can get 57,000 people through the testing system, we were going to encourage everybody, whether they had symptoms or not. In fact, on that basis, my wife and I went through the system and ordered some home kits. And on the government website, when you get into it, it says if you got get a testing kit if you've got symptoms, but it specifically mentions the Leicester area. If you haven't got symptoms, please get a testing kit. I was absolutely distraught to find that 2 nights ago, a leaflet has gone out, which I actually received today via the Royal Mail, which makes no mention of Oby and Wigston. But the real problem is it does not mention that we want to encourage everybody in the borough to get tested. It goes completely against the message that was given to us as district councillors to go out to the residents and say, please get tested regardless of anything. And that has been very, very disappointing. While I've been sitting at the meeting, received an email from Oby and Wigston to say that the message seems to have changed. We are no longer saying go out and get tested if you haven't got symptoms. So consequently, yesterday I tried to get this leaflet stopped from going into Oby and Wigston. It makes no mention of Oby and Wigston. And to confound things, as far as my residents would be concerned, it's got on the envelope, if undelivered, please return to Leicester City Council. So they would see that, and it would have no relevance to Oby and Wigston. And I doubt if they'd open the envelope and say, oh, we're not in the city, it doesn't matter. So I think my question is, has the policy been changed since Monday? Are you going to send a leaflet out counteracting this one that says, please go and get tested? I'm not sure what has happened with regards to this letter to the other county areas is it Charnwood and Blaby, parts of there which are covered. Have they got this letter? And if you can just give us an idea of what's going to go ahead, please.
Right. I think you're the best person to answer.
Yeah, I'll do that one.
So orphans, we've all had the same leaflet came through the post, and obviously it's being posted out on behalf of the city and county. It's a joint leaflet, but I'll let Mike answer that one.
Yeah, so this is the joys of being a national first and implementing and designing a response simultaneously, which is difficult, and also trying to do that when the focus is on the city, but actually wanting to make certain that there is due regard paid to the county areas in lockdown is a best described as a moving feast, to say the least. To my knowledge, I can think of about 5 different plans that we've had for testing in Oby and Wigston over the last few days. So if you've been confused, don't worry, so have I. We came up with a plan and then we had to roll that back, and then we've stood it back up, which again, some of this is making certain there is capacity to go into Oby and Wigston. as the most affected borough, whilst not taking away from the real hot zone, if you like, in terms of the city centre. So many things I could say. The leaflet was a print of a city leaflet, which at the time it felt prudent to get extra done and send out to affected areas within the county. Since then, I've lobbied for, and we have developed our own routine aligned to the city's routine for testing, but specific to the county. So Oby and Wigston is best described as a mixed economy, if you want to call it that, which is I would encourage, as I would with anybody within Leicestershire and certainly within the lockdown zone, that if they have symptoms, to get tested, to use the portal on the DHSE website to get a home testing kit, or to use the military mobile testing units like the one we've had at County Hall in Glenfield for the last few days, and also the one that's been in existence for some time at Birstall, to get tested. And then within Oby and Wigston, as our most concerning spot, we will be deploying in particular areas, and I can't name them at the moment because we're literally just working up the comms on this, a different policy for selected areas where there's been most cases, which is for all people, those who are both symptomatic and asymptomatic, so basically testing everybody. And we'll be putting in place additional testing capacity, which isn't a drive-through, but is a walk-in centre, if you like, within the kind of venues that you'd expect polling stations to be. So it has taken some time, I suppose, to balance the capacity available to us for testing with the needs of Oby and Wigston, and I apologise if we've been up and down. We had a plan A and a plan B, then we're back to plan A, but I think we've settled now on encouraging everybody to get tested if they've got symptoms, and supplementing that with additional capacity if needed for asymptomatic patients in selected electoral wards within Oby and Wigston. And Oby and Wigston are first, but I would suggest that variations on a theme is what we'll then roll out to other areas within the county that are in the lockdown zone. So again, encouragement everyone with symptoms, and deploying military mobile testing units appropriately as near as we can get to it. So it's taken a while, but well, in a relative sense, we've probably done something which no other areas had to do before, but we've managed to do that, even if we've wasted probably 2 or 3 days in working up an appropriate routine. But the Oby and Wigston plan is encourage everybody with symptoms, deploying additional testing capacity and encouragement in particular areas for those who are asymptomatic.
I'm sorry, just for clarification, are you saying particular wards will be encouraged to test even if you're asymptomatic, or is it the whole borough?
No, whole borough is just symptomatic, and then particular wards will be asymptomatic as well.
I don't think that's quite clear.
How can I make it more clear?
Well, it's just the fact somebody is going to say that if you live in a particular ward, the whole of that ward has got to be tested.
Yep. So that's right. So again, I don't want to do it on a health and wellbeing board because it will set hairs running, but we're working with colleagues in Oby and Wigston Borough Council to do that, what will be localised community engagement and media, so that those people in the wards know that they're the ones who should get tested regardless of whether they've got symptoms or not.
Thank you. Thank you, Chair.
Thanks, Mike. Councillor King.
Thank you, Chairman. Thank you. So first of all, I want to put on record as one of the district leaders and leader of Harbour District, my thanks to all health colleagues and everyone else, social services, etc., or for all the efforts, all the work that's been done over the last few months. We've all faced a challenge which I expect back in February we probably didn't ever think was ever happen. And we've all been putting in ridiculous hours of work and commitments and all the rest of it. And your teams, I know, have been doing that under tremendous pressure at the best of times. However, there are obviously concerns, which obviously I've already mentioned some of those already. And Andy, I'm grateful for your comments about how you're going to try to get services up, back and going. Normal services, if I can put it like that. Clearly, there are some significant issues in order to do that still, given that we've got the local lockdown. My concern is around community and day services, because that has an impact wider than just adult social care, because there's lots of village hall, community centre venues that rely on income from various community social support groups to basically make them viable. Of course, at the moment they haven't got that income, so it's kind of difficult. One of the big things, putting my carers centre hat on now, is respite breaks for carers. So previously carers who perhaps looking after someone at home on a a fairly intensive basis. If they were one of the vulnerable groups, they've been doing that 24/7. They've had no break, no respite, and that's a really difficult thing for some of the carers. They are also, I think, at the end of their end of their tether, end of their physical capacity and mental capacity as well. And I'm just, I think that perhaps needs to be a bit more emphasis on in whatever plan that's been looked at, how we can, the joined up thinking, joined up working can look to support those people better, because there are significant numbers. The last census, if I'm right, was about 110,000 across Leicestershire. It's a lot of people, and it increased because of the impact of COVID. So the other thing, obviously, I'm not going to get into the whys and wherefores of whether this could have been better, that could have been better. I don't think Leicestershire, we've had the worst of it, but we haven't escaped unscathed either. There are significant issues, I think, in respect of testing and PPE in the early days. And I think there's some very painful lessons that have been learned, and unfortunately, and also in respect of care homes. I think that's a very significant issue. I've got a relative who went into a care home, not in this area, I have to say, absolutely okay, and unfortunately caught the coronavirus in the care home. They're still with us, but their health has been extremely debilitated as a result. And it's another part of the country, but the experience has not been a good experience in any stretch of the imagination. And there's a long-term effect. And I think that was raised with me the other day, is about people what are we doing to support people who might have had coronavirus, moderate strength cases, but they've now got some level of debilitation, ongoing health issue. What is the system looking to do in terms of supporting those people, that cohort of people? I don't even know how big that group of people is locally, but it is an issue that's been raised with me via social media, and I said I would raise it today. But one of the biggest concerns I've got currently is the outbreak plan, Mike, that you talked about, and it's on your presentation. I'm not happy with that at all, about the political governance, about the communication at a political leader to leader level. I have raised that with the leader of the county council. I haven't had a satisfactory answer. I'm raising it now. I don't think it's acceptable to just have the three leaders, the county council leader, the city council leader, and the leader of Rutland County Council, as the only people on the political oversight body of that group. I think there could have been a way to involve the district leaders or a district elected representative in that group, as we do with strategic planning. I think that could have been done. I don't see why it can't be done. And I'm very disappointed that since the outbreak was declared in Leicester last Monday, I've had 2 communications from the county council as leader of Harbour District Council, and we border the local outbreak area. I've seen today, although it hasn't actually been sent to me by the county council, I got it sent, and actually I read it on a link on Twitter, the report that you've released about the super output area data, and I've seen that, and I'm very, very concerned now about the boundary area at Scraptoff, Thurnby and Houghton, which is part of the Harbour districts, and what's been done to address the fact that the potential risk that the number of cases that, and it is high, will eat the rate compared to the other areas, although in absolute terms it isn't, I suppose. But what's been done to address that? And the leaflet that's been talked about, I didn't even know there was a leaflet going out. I haven't received that. I haven't received any information. Completely in the dark. And that's exactly the point I'm making. You just exemplified it. The communications, with all the pressures and everything else, it's absolutely imperative that those sorts of things aren't just communicated to the select group, but are communicated around the wider district leadership, so we actually understand what is going on, what is being done. Because if we don't, and then I get a resident in one of these neighbouring areas contact our team or contacts me and says, what's this about? I haven't got a clue what's going on. So that's not terribly helpful, although it is helpful that Councillor Kaufman's raised it today. But I do think that's an area where there does need to be some improvement, and there does need to be some thought given as to how districts, because the impact of the Leicester local lockdown isn't just within the lockdown area. We've got a clear connection. It doesn't respect administrative boundaries. Coronavirus doesn't go, oh, I know, I'll stop at the boundary of Oadby, I'll stop at the boundary of... It doesn't do that. It doesn't work like that. And you all know that. So we do need to communicate on a wider basis. And I'm, as I said, the fact is there's only been 2 communications since last week directly with me as a leader of a district council, which represents 28% of the landmass of Leicestershire County. And that I find very disappointing. Chairman, I'll leave those comments there, I think, for the time being. Thank you.
Okay, thanks, Phil. I next have Mrs. Taylor.
Thank you, Chair. Just a couple of questions, if I may. Just a very quick one for John about the shielding group. Are people still being added to the shielding group that are within the lockdown area?
So the list is still live until the 17th of July. So until the 17th of July, the new registrations are still being added, is my understanding.
Do you know what's happening after that point, or is it just going to depend on the review of the lockdown? Is that what we're waiting for?
The national list, at that point, there'll be no new registrations to the national shielding list. Obviously, if we identify people who are isolated, requiring shielding outside of that process, we will continue to support those people. And there is a process in place that we've agreed with the City Council to support people in the affected area for the whole period until the current situation is resolved. So we are continuing to provide people with, although the national food parcels stop at the end of July, we will continue to provide them if that's required via the City Council. And medication will continue to ensure that people get medication deliveries, etc., etc. So we're putting a specific local process in place.
Okay. Okay, thanks for that. And if I may, Chair, my second question really is just about the opening of schools. Obviously, we're due to start reopening on the 26th of August, but schools are being given the opportunity to be quite flexible. But we're expecting all Leicestershire schools to be back by the 1st of September, including early years. I've read the plan that's been included that was sent out this morning, but I am really concerned that obviously the bubbles are going to be quite big. A lot of the schools are actually going to be year group bubbles. And if we do get an outbreak, that's going to be a lot of people affected and staff, etc., etc. And I can't see any robust plans in place as if we do get an outbreak within schools or early years, how are we going to tackle that? So is there something in place? Is that being worked on?
Probably me to come in on that one. So yeah, in terms of the outbreak plan, we've managed the cases that we've had within there. You're right about the size of some of the bubbles. Same with my daughter's college. A bubble of 1,000 pupils that's not a bubble, that's a village. And I think there will be an issue there in terms of testing and strengthening the outbreak control plan as we go along. Of course, some of this is right in the plan before we knew what the plan was for reopening schools. We do have an exercise tomorrow internally to test the resilience of those plans, and I think that will need to encompass the new guidance in terms of where we're going in terms of educational reopening. But yeah, it's a fair issue to raise, because I think it's a fair point around the size of some of the bubbles there may be.
Is that possible to get, once that's clarified, and is that possible to see sight of that? Where will that go?
Yeah, she'll do the revised plan.
Yeah, if it does.
Yeah, we publish it. And again, there's 2 bits. There's the plan that goes on the website, which will review in the light of today's comments and indeed a number of other ones. And then there's a detailed operational plan that sits behind it that's more for the council and the department. But again, I'll make certain you have sight of both.
Okay, thanks, Chair.
Okay, thank you. Mrs. Radford.
Thank you, Lee. I think my question is more to Mike. There were mentioned about the leaflet going around to certain areas of the county, but a young lady said, and I think it was harsher when we were discussing the Health Watch, that some of the residents can speak the language, but they can't read it. So have we got anything in preparation for letting them know verbally? Are we going to get in touch with the faith leaders and things like that to let them know? Because that was one of the things that's come up, that they were aware of it, but they didn't understand it because they couldn't read it and things like that. I'm just wondering how we go into, because we really need to get the point home, don't we? Because we really don't want this lockdown to carry on for too long.
Yeah, no, absolutely. That's a very good point. And clearly it's one of the key things that was learned through the experience of Leicester and the diverse communities in Leicester and where they get their information from. And then, as you say, the issues around not speaking a language, but not necessarily reading it. So if I take Opie and Wigston as an example, I'm really grateful to officers within the council who've been working with us to think about how do we engage with community leaders and faith leaders to do exactly that kind of on the ground walking and communication, as opposed to just relying on leaflets, because we can talk about good comms being translating leaflets into other languages, but I don't think even then that hits the mark. You're just producing stuff that doesn't get read in a number of other languages. But that's the hookup with district and borough councils in particular, and the understanding of local community. So I'd like to see that replicated throughout the county.
Okay, thanks, Mike. Can I just check with Mark? Mark, you did have your hand up earlier. It's gone down, so I just want to check that that's purposeful and it hasn't disappeared without your involvement.
It was purposeful. I was going to come back on one of Councillor King's comments, hopefully with something useful, but I think in the interest of time, I'll follow that up offline.
All right, thanks, Mark. Okay, I think that's probably covered the report and the questions that members have with what's been shown. I think we're now going to load up an up-to-date reflection. I think Matt is he's putting that onto your screen now, and Mike's going to walk you through the latest situation with the update report that has now been released. So if you just bear with us, hopefully your screen will be taken over, and Mike will then be able to walk us through the presentation that he has. With there, and I think it's open.
Loading.
Okay.
It's showing as screen.
Have people now got that on their screen? Certainly I have, but I'm sitting next to Matt, so it's Mike. I think it's over to you.
I'm just getting the circle of death, so let's just give it another couple of minutes, shall we?
Okay.
If you hear me scream, please get off the Wi-Fi now. You know that someone in the house is streaming or otherwise gaming.
Okay. Okay.
We can give it.
Have people still got the circle of death? I'm not too sure how you'll tell me because my screen's now got the presentation on, but I can just see a row of characters at the bottom of the screen which don't really show me much, but I'm not too sure whether people...
I've got the presentation up, Chair.
You have?
Oh, it's just gone again.
Yes.
It was there.
Mine's gone as well, so it's... Okay, Matt's just going to try once more. So it's
mine's gone.
Okay, he's just trying it once more to see if we can get it in and up. As I say, we just had problems with the fact that the chamber has been sealed off, and I think the servers have had to be rerouted. But I'm not too sure whether we're getting full ability. So
it's back up on my screen, Chair.
Yeah, I have it.
No, sorry, it hasn't reached lockdown Oadby.
No, I don't think. I think look
in business.
In business, so lockdown Oadby's got it. So
it's just knackered Nottingham that hasn't. There we go.
Well, if you will live in Nottinghamshire, not the county of Leicestershire, Mike.
I know it's my own fault.
Yeah, we've got it in. I've got it in Shepshed. Just
I've got it now.
You see, Leicestershire's super fast broadband is much better than the rest of the East Midlands. I've still got home circle.
I've got it in the city of Nottingham, I hasten to add.
And I have it even in North Nottinghamshire. So
oh, I've got can't display content.
Just yours, man.
Right, I'm going to try and do this. There's no point trying to load mine up. Has everybody else other than me got sight of it?
Yeah.
And Matt, are you able to be my hands and eyes at this point?
Yes.
Okay. So just to give you the background, I won't go into too much about data because obviously there's an awful lot has been said about access to data nationally. But in common with other authorities, we started receiving postcode level data on cases within Leicestershire towards the end of June, so the 26th of June, Friday.
You can.
Since then, we've had 2, maybe now 3 data dumps of cases which come to us on a weekly basis. And that has enabled us to build maps which give a much better granular level of detail on where cases have been within the county. So just to take you through some key points, and Matt, if you can move us, I think it's page 2 and the bar chart with blue and orange bars on it.
I think we're just trying to get it back up, Mike. As I say, I think it's
I was going to say I've lost mine.
Yeah. Matt's just going to try and load. I think we'll try once more, Mike. I think if not, perhaps if you can if you can, best endeavours, give us a heads up.
Yeah, exactly.
Yeah. I mean, certainly what Matt's going to do is he's going to email it round after this meeting to make sure that everyone's got a copy of what Mike was talking to and giving us a heads up. So
I'm there.
So it's.
Oh, sorry, I realised it's a set of slides, isn't it? Yes.
It is. So
Shall we
I
try
now have
again
it I now have it on my screen, so hopefully we can sort of best endeavours and move it forward. So it's all I can do is apologise.
Right, I have taken control. Right, so I just want to settle on this one, having done the introductory blurb. These are the blue and orange bars that I was talking about. And in terms of the new data and what it tells us, the blue bars have always been the figures that have been publicly available around testing. So this is testing for those who have been admitted to hospital or who, when the Public Health England are investigating the first cases in a care home outbreak. And I suppose the starting point is we'd recognise we're in a far better position from a point of view of pressure on the health service than we were. So in that peak weeks, around about end of March through towards Easter, you can see we had about 200, 180, 160 cases in the Pillar 1 testing, these clinical priorities coming through Leicestershire. But you can see that since May time, that has really gone down now to a level of around 20, 30 per week. So we're in a much better place than we were from the point of view of the pressure on the health service, as Andy set out. But then along comes Pillar 2 testing, the orange numbers, which are community-based testing, so all the tests. And you can see that although those figures have come down, 195 in the peak week to say 105 last week, they've not come down as far or as fast as the Pillar 1 testing. So there is something which is reflected certainly within Leicester City, where those figures have just gone up and up, but within Leicestershire, where they've not necessarily come down as fast as far as other places, which would suggest that we've got a kind of higher latent level of infection doing the rounds in the county. Then if I come down to the next slide, this is just to dwell on the age profile of those 2 lots of testing. And as you'd expect, the clinically prioritised testing, the Pillar 1 cases, are largely in older people. So the 80 pluses making up the vast majority of Pillar 1 cases. But if you look at Pillar 2, like the findings in the city report that informed lockdown, much more concentrated in the working age population, not so much in 0 to 19s, but you can see a rump there in the 20s through until up until the age of 60 before actually dying down in older people. So community cases, much younger, middle age 45, as opposed to Pillar 1s, which are 73s. I won't dwell on this one. This is just basically accounts of cumulative cases by district within Leicestershire. But this one, in terms of what that means in terms of rates per 100,000, I think is a key stat. So the average for England in terms of cases per 100,000 population is about 425, something like that, 438 rather. Leicestershire's is about 425 and the East Midlands is about 426. So On the one hand, you could argue that the Leicestershire rate is very similar to the regional and national average, and therefore we've got no need to worry. But around that, you can see that there's a great variation between districts. So Oby and Wigston from the start has been our most affected district with a rate of about 770 cases. So again, not far off, 50% more than the East Midlands and the Leicestershire average. That compares with a city rate, which obviously is higher, of around about 1,000, 1,100. So Oby and Wigston, in terms of why would that be within a lockdown zone, has got issues, which again probably means we would need to take extra care within Oby and Wigston. And I suppose the other bit for me on that one is, if we'd have done this presentation 6 weeks ago, I'd have said that Leicestershire's rate was well below the national average, whereas now it's very similar. So reinforcing the message that the drive down in virus rates has not gone as far or as fast within Leicestershire as it has the rest of the country. That's borne out by our kind of rising up the league tables, if you like, to be somewhere near the national average, the East Midlands average. And then I suppose that the key bit is using this to map. So until this data started coming along, and we produced these maps a few days ago, we didn't have anything below the district and borough level, whereas now at least we can start telling a tale about what it means at what's called the MSOA level, the middle super output area, which divides Leicestershire up into about 87 different areas. This one is total cases. So again, it depends a bit on the number of people that live in the area. But you can see there that although it doesn't prove or universally prove or disprove why a boundary line was drawn where it was, I'd say it was indicative of two things: that areas around the city tends to be those areas which have been associated with more cases and a higher rate of cases. So if I think about that hit list, Oby North and East, Wigston Town, Thurmaston, Braunston, Birstall, and indeed Oby South and West, and even Glenfield with 55 cases are all in there. I know Councillor King referred to Thurby and Scraptoft. We didn't have that map available to us when we draw the line. We did say that the map was never going to be 100% precise, but I think you look at that and go, there'd be a good place to include it. And if it's not, then there needs to be a clear message to the residents of Scraptoft that they're in no place to treat this with complacency, and they need to follow the same rules, the same observation of social distancing as everything. But equally, there are other places there, notably in Hinckley and Bosworth, a bit down in the middle of Market Harborough, where if this became a game of going the city and its surrounding areas infected and other parts of the county are scot-free, if you like, then I think that would be the wrong message to give as well. And there needs to be a strong message, I think, given by me at the Health and Wellbeing Board, and hopefully by Health and Wellbeing Board members, that there is no room for complacency across the county either. And if I give you a relative indication, I think yesterday there were probably 72 cases in Leicester. In Leicestershire, we had 24, which you would argue, given the bigger population in Leicestershire, would work out about a sixth the level of the cases in Leicester City. And we could pat ourselves on the back and pretend that the city issues are nothing to do with us. But if I said I think Nottinghamshire had 7 cases compared to our 24, I hope that puts over the impression that we are actually in no place, as I said, to be complacent. And if you like, if this was a tide, the sea of infection has gone out in the country, but there are rocks and boats still floating in Leicestershire that we need to suppress. The rate per 100,000, which adjusts for population size, I think reinforces that generality around rates to do with the boundary of the city. And then in terms of a picture currently, this is what we've got for the last fortnight. And again, if anything, you can see large swathes of the more rural parts of the county up there in Melton, and again over towards bits of Hinckley and Bos and northwest Leicestershire are looking good the last 2 weeks. But again, there is certainly no room for complacency in other areas, notably around the boundary of the city. And again, I think the last map of 100,000 population rates reinforces that. So that's a quick gabble through the data we've got. Now we're getting this, we can refresh this on a weekly basis, and I would want to, coming back to the point about comms, communicate this widely both to members of whatever layer of local government and indeed the public, because I think it's important they understand on a local level what this means for them at the moment. But I'll pause there. Thank you, Chair.
Okay, thanks, Mike. I mean, certainly my mailbox coverage in Glenfield has been inundated, and also parts of Leicester Forest East. But I think the problem is it is misinformation. I mean, people are reading things on Facebook and quoting them that are totally false, and they're picking up things from other media sources. And I think I think if it's weekly data, that's really useful, and I think we do need to communicate this across all levels. Obviously, I think what Councillor King has said, these updates need to go out. I know it went onto the website last night once we got the data sharing and confidentiality sorted out, which has been a huge problem, which is why people have been asking where's the data, but we now have that, so we can move forward with this, and hopefully people will understand, as you say, why the line was drawn, where it was drawn. That line can't change. I think people keep asking me, but the statutory instrument in law, which came into force on July the 4th, actually states each postcode that is involved within the red line. So to amend that, it would have to be a new statutory instrument. So I think that sits as it is for now, and we look forward to review next week, and hopefully we can have some progress on that. So I have Councillor King with his hand up. So Phil.
Thanks for that, Lee. Thanks, Mike, for your presentation. This is exactly what I saw earlier, which had been put on social media by a leader of who happens to be a county councillor who'd obviously been sent this. I didn't happen to be sent this, but I happened to follow him on Twitter, and that's how I found it. But just one thing, one thing I do want to mention, in a presentational point of view, it's not Thurby, it's Thurnby. So if you are going to, you do need to make that correction to your presentation. Otherwise, the people will be wondering what the heck you're talking about.
Yes,
and
yes.
Your email box and mine will be very full very quickly from residents there. But what I am very, very concerned about, you mentioned it in your presentation, Mike, and this is exactly the point I wanted to make. I was trying to make earlier. You know, the thing is, last week we had the city mayor going around saying, yeah, it's okay, go to Market Harbour and have your pint. We had obviously a bit of a fracas around in a couple of pubs on Saturday night, which wasn't terribly helpful. But the point is, you know, that data is demonstrating to me very, very clearly that we're not out of the woods. And I've been saying that, but I've not been getting a very clear message coming through. In fact, very little in terms of communication reaching me, coming to me saying, right, we're not out of the woods. Now, this backs up exactly what I've been saying, and I know that you've been saying, that there is a problem. It's not just in the lockdown area. There is a problem outside of that. And if we, the public, if residents do not listen to what they're being told, that lockdown area, in my view, will be extended, and the lockdown period will be extended, because we are not getting down on the infection rate. Because this is way, way above what the rates are, and you know better than I what they are elsewhere in the country. And the government will, I think they will not, not for me to predict what they will do, but if I was thinking about it, I can see them extending it, and actually potentially extending the area because at the moment, unless the testing does start showing a decline in the next few days, I can't see why they would stop it next week, because if it stays at this level, it indicates that people, and there's still a problem with the infection rate carrying on at a reasonably high level. So I think there is a very serious issue here, and that's why I made the point earlier about political engagement. There has been minimal political engagement with district leaders about these matters to discuss, and I appreciate that's not necessarily your job, Mike, but the people on this call, this needs sorting out so we can have these full and frank discussions and understand exactly what the situation is, so that we in our districts can say to our teams, right, we need, and to my district colleagues and to the parish councils and all the other stakeholders we've got, look, this is a serious issue and we need to all work together. It's not just, oh, it's them in Bladeby, or it's them in Glenfield, or wherever it is, or it's in the city, or it's in Oadby, oh, we don't need to worry. Because that's when you talk to people, as I do in my area, that's what they say. They say, oh, we don't need to worry about it. We can go to the pub, we can do this, we can do that. And what this is saying to me is, well, actually, there's a big problem. And if we don't get on top of it, some of these areas are going to be joining the lockdown area. That's what I wanted to say. Thank you.
Okay, thanks, Phil. Dr. Hanlon.
Just a question about the extent to which the number of positive cases is determined by the total number of tests done. And if we're about to do a lot more testing in Leicestershire or in Leicester City, we're clearly going to get a lot more cases.
Yep, it's a good point, and some of this is about case finding, because what we've seen, as you would expect, particularly at Wigston and Blaby, is people have been worried about what's going on in the city. They've probably got better access in some places to testing. So I think there are sort of two league tables, which I don't think are in a public domain. But if you look at, or at least some of this is, people will be aware that Leicester City, in the weekly 7-day infection table that was on the BBC website last week, was top of the tree. Or actually, Tadlite, Merthyr Tydfil was top because of the outbreak in whatever plant it was, and then Leicester was second, way ahead of other places that got mentioned like Bradford and Rotherham. And Leicestershire wasn't on the top 10, but was probably bubbling away on around about 15th. This time round, I expect us this week to probably make the top 10. Now, some of that will be because we are seeing greatly increased numbers of tests in county residents. I don't really want to apologise for that. I think that's a good thing that will flush out cases and means we can isolate them. And the opposite is going to sound a bit Trumpian, and we end up going, oh, we can make life better by not testing as many people, which probably doesn't seem like the right thing to do. And I suppose the other bit, though, to feed in is, as you do more tests, you would expect the positivity rate, the percentage of positives that you would find to go down. Leicestershire's positivity rate, again, for some time has been higher than the national average, probably about double. So if the national average positivity rate's about 1%, Leicestershire's has been 2%. So like my earlier reference to numbers of cases being 6, what they are in the city, do you say when the city's positivity rate at its top was about 12%, no need to worry, this has nothing to do with us, we're a 6th level of the city, or like Councillor King, take the view that actually having a positivity rate as double the national average doesn't put us in a great place. It is a slightly different message. I think if Leicester have seen numbers increase, for us it's very much a question of numbers refusing rather stubbornly to drop persistently. And I think, some of the analogies that I've used along the lines of there is more tinder in Leicestershire that could catch fire, or that if the fire in the city, if your next door neighbour's house is on fire, you've got a problem whether you like it or not, holds true. So I neither want to panic people into thinking we've got a Leicester style issue, but we have got issues exactly as Councillor King set out. And so the same with positivity, the cases is numbers of tests is one issue, but it's not the only, and our positivity rate is higher and has been for some time.
Okay, thanks, Mike. I've got no other questions for that, so I think that's been a pretty good update and a pretty good overview and a good discussion. I think all the points raised will be taken forward. I think from your point of view, Phil, I think 5 of the leaders of the borough and district councils sit as county councillors, and I think certainly we've had very good weekly updates going in. I know they've been shared with the chief execs, and I know they've then been fed out, certainly by Blaby District Council. I always also wear a Blaby District Council hat, and they've been fed out and echoed and copied from Blaby District off the county councils. So, but certainly if there's an issue there, that can be addressed and dealt with outside of this meeting. So can I thank Mike, Andy and John? I think the work you've been doing, I mean, the start of my position statement, it was to thank on behalf of the board the work you've done. And I think now we'll get involved in sort of the recovery aspect of that. But we are asked to note the impact of the COVID-19 on Leicestershire's health and social care sector and the loss of life in the local area, and also note the publication of the local outbreak and control plan for Leicestershire. So I think that's been pretty well covered. So can I thank you all for your assistance on that. Finally, we're also asked to note the current situation in the protected zone of Leicester City and also parts of Leicestershire. So once again, thanks for your presentation, Mike, and we look forward to getting that data on a weekly basis across all parties. So thank you. Item 10 is a report on matters considered between the meetings of the board. Obviously, this was a large part of the agenda pack if you'd got a paper copy or looked at it, but the report summarised a number of matters which have been considered by members of the Health and Wellbeing Board outside of the formal meeting process due to the recent cancellations of meetings as a result of the coronavirus pandemic. Members are asked to note the report. Does anyone have any questions they wish to raise on what was dealt with and considered? Can I know a lot of members, they were asked to comment on papers that were emailed to them, and a lot of you have done that. So can I thank you for that and to allow the business to continue and putting inputs in on various matters were dealt with. But I'm showing now. I've just got Dr. Hanlon. Is your hand still up from the previous point? In which case I've got no hands showing, so I'll just say that that report is noted. Thank you. Item 11, our final item today, was the Health and Wellbeing Annual Report 2019, which is in the pack, from pages 213 to 238. I'll hand now over to Matthew, our Democratic Services Officer, who will present. So, Matt.
Thanks, Chair. The annual report reflects on the work of the board during 2019. The report provides an overview of some of the achievements and outcomes of the board and its subgroups, including the activities supported by the Better Care Fund plan. In particular, the report highlights the board's continued focus on mental health and wellbeing, including how effectively services are being delivered across the county and the impact of the mental health investment. It also summarises the board's continued good work led by the Children and Families Partnership, including its recent focus on adverse childhood experiences. The report ends by summarising some of the matters the board will be expected to consider during the rest of 2020, including several new JSNA chapters and a new pharmaceutical needs assessment. It is also recognised that much of the board's emphasis will focus on the impact of the pandemic and how the health and care system can evolve as it recovers from COVID-19. Members are asked to approve the annual report, which will then be published online. Happy to take any questions. Thanks, Chair.
Okay, thanks, Matt. Any questions or comments for anyone? I think the only thing I looked at, it's interesting, the mix of reports that you're getting now. Some are very easy to read, they're very plain English, very simple, lots of pictures, lots of infographics. I think the County Council's moved on its reports to a sort of corporate style over the last sort of certainly 12, 18 months as far as I can see. But whether we need to have a mix of a bit more sort of interest just to keep people's reading, because when you're reading through pages and pages of purely text, sometimes it can get a bit drab, but there is a splash of occasional county council creativity in there, but it's that was the only comment I made. So I'll just quickly scan down and see if there's any hands up and available. No, there isn't, so I can hopefully take that members are asked to approve the annual report. Oh, Phil, Councillor King.
Yeah, hi, thanks for that, Lee. Just a quick query. Is there a reference, sorry, I haven't read this completely, this bit of the agenda, but is there a reference in the report to the work of the light bulb project, which is the integrated county and districts disabled facilities grant scheme?
As far as the actual reference in the report, I'm not sure without going through it all, but I do know that the board are regularly updated on the work of the light bulb project. But as I say, it's whether it's made reference in the report, I'm not sure without going through it. But if it's not, then I'll make sure it's included in the next round, because I'm sure the board will receive updates in the near future.
Okay, thanks, Councillor King. So we're asked to approve the annual report, so I'll do that. Thank you, members. Item 14, actually, let me just check, item 12. Yeah, I've just got a slight, yeah, item 12 is the date of the next meeting. The date of the next meeting of the board will take place on Thursday, the 24th of September at 2 o'clock. It may well be virtual, but it'd quite be nice to see you here at County Hall again, but we shall hopefully have more success at the start of the meeting than the problems we had today. And item 13, any other items which the chairman has decided to take urgently? As I mentioned earlier, there are no urgent items. So can I thank you all for your attendance today. Keep up the great work. Please stay safe, and apologies for the technical issues we had, and have a good evening. Thank you all.